He goes out of his way to explain it so that we, the patients, understand what's going on. First of all, what's wrong, and second of all, what he's going to do about it. I've gone to chiropractors before. That makes you different. In my humble opinion, that's what I wanted.
Awesome.
I wanted to have it fixed.
Hi, Dr. Michael Pasternack, a chiropractor in Winchester, Virginia. I'm with Winchester Spine and Injury, and I specialize in auto injuries, whiplash type injuries, and pain like neck and back pain after a car accident. Today I wanted to talk about an interesting dilemma or question: pain relief versus corrective care. Pain relief being, do you want to treat just to get out of pain? And corrective care obviously is, do you want to treat the actual underlying cause of, what started the pain happening in the first place? That decision is completely and always up to my patients. I try and do a super thorough exam, a really thorough consultation history. Usually I'm going to end up taking some x-rays if it's, clinically warranted. And then I'll have a patient come back for a follow-up visit, and I'll really simply try and explain what I found in a way that the patient understands. And it comes down to really two choices. Choice number one, do you want to do just pain relief, what I sometimes call patch care, or do you want to try and, as I said, get the problem actually stabilized or fixed as best as possible? Probably 5% of my patients choose to have patch care or pain relief type of care, and that's totally fine. I'm here to do whatever makes sense for them. Roughly about 95% of my patients decide it makes better sense to actually address the underlying cause and try and get that stabilized. Like an example would be, if you lose the alignment on your car and you didn't fix it, it's going to put abnormal stress on your tire, and then that tire is going to start to wear out. And so if you put a new tire on, but that's all that you did, that would be patch care or pain relief care, right? It's a temporary patch, it's quicker, it's easier, it's cheaper, and if that's what makes sense for you, then I'm more than happy to do that for you. So corrective care has a little bit different goal. Yes, of course we want to help you feel better, we want to try and get you pain relief, but we also want to make sure that we get things working as good as possible on the inside, that we're really fixing the underlying problem as best as possible so you can have a great long-term result and really optimize your wellness and well-being. So if in that car example, it would be yes, you put a new tire on, but then you fix the underlying alignment issue. And so that's what my goal is. It's interesting, I was talking with one of my patients last week, Ed. Hey Ed, come on over a second. And Ed, thanks for coming in.
Sure.
Ed graciously decided that he would, he made a comment to me last week. I'm like, wow, that's so fortuitous. You like that big fancy word? Because I'm actually shooting a video talking about that next week. You should come in and say that. And he's like, yeah, sure. So Ed, you're one of my patients. Now, you've been a patient of mine how long, you think?
Probably about a month.
About a month. And I think, so what made better sense for you? Pain relief or corrective type care?
There's no question. And first of all, I gotta say, I have never had the opportunity that you offer that makes you different with regards to either patch care or actually fixing the problem long term. I've gone to chiropractors before. That makes you different. In my humble opinion, that's what I wanted.
Awesome.
I wanted to have it fixed.
So you're saying that in your past, going to these other chiropractors, who I'm sure were good,
Sure.
They just did sort of patch care. They don't even offer the option to correct it.
They did not offer that to me. I went in, of course, really hurting, and they would fix me. They would, move me around and
They put a new tire on.
They put a new tire on. 3 or 4 trips, done. Thank you so much. You, on the other hand, wanted to actually do it the way you said in your
The
example.
reportable. Yeah.
You wanted to do the alignment. You wanted to get it all right so that it stays that way.
And how are you feeling since coming in?
Wonderful. It's unbelievable.
How many visits do you think we've done off the top of your head? Like 8, 6, something?
Something like that, yeah.
And so I think so you're feeling much better.
Right.
And so the goal of, like I said, of corrective care is, of course, we want you to feel better, but that's when we really just start on getting things working better. And I'm going to talk more about like muscle memory in the next video, but think of it like tooth decay. If you're not brushing your teeth properly, a tooth is going to start to wear out, but it doesn't hurt at all. But then maybe 6 months, a year, a couple years later, one day you wake up and your tooth is killing you.
Bam!
Now you could go into the dentist and they could probably give you a shot of Novocaine, right, and make it feel better.
Right.
That would be a temporary solution, right? It's quicker, it's easier, it's cheaper. Or they could actually like work on the underlying problem. Maybe you need a root canal or you need a filling. I don't know, I'm not a dentist, right? But that's sort of the difference. They say an iceberg, I don't know if you've heard this, that like 1/10 of that iceberg is above water and 9/10 is below water.
Right.
In the disease process, when pain comes, pain's the last thing to show up. It's like that 1/10 that's above water of that iceberg. You have that 9/10 underneath that's maybe the muscle spasm and the tightness and the swelling and the joint having adhesions and being stuck. And so that's what I'm trying to work on with corrective care, is to improve all that stuff.
So could I say one more thing?
Yeah, absolutely.
This is another thing that differentiates him, okay? And I want everybody to get this. He goes out of his way to explain it so that we, the patients, understand what's going on. First of all, what's wrong, and second of all, what he's going to do about it. I've been to docs before. They use these long terms that mean absolutely nothing.
Don't you hate
to
that?
me. I hate it. It's confusing.
Why
to the
waste
point
your
where
time and waste a voice even saying
I
it?
can't even ask an intelligent question about that. But then they ask, do you have any questions? Of course.
You don't even know where to start.
You say, can you repeat it? That's not going to help at all.
Yeah.
He's different.
The choice is always going to be yours, what makes better sense for you, just pain relief or corrective care. I'm here to help you however you want. Go ahead, follow us on social media and pass this video to someone that it can help.
One final thing,
Yeah.
and this starts at the top. This office is run efficiently, professionally. Everybody here that works in your office is courteous. I made a good decision.
Thank you so much.